You know she's a seasoned traveler when she's standing on the planet.
Yeah, when she's standing, she literally conquered the world, and bon voyage.
I know, but that's actually fantastic stuff to travel smart and light, and it's easy and convenient. Do you travel a lot?
Not as often as I would like to.
I just travel from my house to the studio and back because that's work. And
you can use some travel hacks then.
That is true. I could use that, and I could use some advice because this is a very important topic. Now, we've all heard about a heart attack, but do you know what a brain attack is? Chances maybe not. Now, you might be more familiar with the term stroke, which is also known as a brain attack. Now, you know, as October 29th is the World Stroke Awareness Day, we have invited Dr. N. Ramesh, consultant neurosurgeon from the Ara Damansara Specialist Center, to share his expert opinion on the subject, and through his, hopefully we can learn how to recognize the signs of a stroke in a loved one. Doctor, thank you so much for taking the time and the effort to join us today.
Thank you, it's my pleasure.
No, it's a very scary thing to think about, a brain attack. But why is a stroke called a brain attack?
Well, this is a sudden insult to the brain.
Okay.
If you were to relate it to war and battle, the attack is sudden when you least expect it, and there are three possible outcomes. You may survive without any damage, you may lose your life, or you may be maimed.
Okay.
Now, between the two, losing your life or actually being disabled, I'm not sure which is worse.
Yeah. Okay. No, but the key thing is, for us who really don't know or not aware of the subject, there are different types of strokes, I believe. Could you explain to us what they are?
Basically, stroke can be generalized into two forms. You have the ischemic stroke, where there's a lack of blood supply to the brain, and a hemorrhagic stroke, or what we sometimes call as a blood clot in the brain, or bleeding into the brain. The term blood clot may become confusing because you can also get a blood clot in a vessel, and you can get a blood clot outside the vessel in the brain. These two types of strokes can further be divided. Basically, if you look at it as your pipe to your house, you can have a burst water pipe, or you can have your pipe clogged.
So the hemorrhage is the burst water pipe, and the pipe clog is ischemic, is it?
Ischemic.
Okay, all right. Now, I'm just wondering, what are some of the most common causes for stroke?
The commonest cause would actually be hypertension. The others would be diabetes. These are the same risk factors as your heart attack, where the blood vessels get damaged. Right. So if the blood vessel is damaged enough, it may rupture, or sometimes deposits of cholesterol on the sides of the blood vessels may actually narrow the blood vessel and cause the blockage.
Now, is there sort of a link between heart attack and stroke? As you mentioned, you know, hypertension is one of the causes for stroke as well.
There's no link, but the symptoms may sometimes be similar. I actually had one lady who was generally feeling unwell, lethargic. So she went in to see my cardiologist at my center, did an angiogram, given a perfect bill of health, went home, came back that night with a stroke.
Oh, okay.
No, doctor, that's very similar to what happened to my uncle just less than a month ago. He's on the treadmill every day, just walking 30 minutes. And then when he went recently to get his, just a checkup, they found out that there was clogs and so on and so forth, and he was really close to having a stroke. I mean, so what are the symptoms, the visible symptoms? You said this person was completely okay. My uncle was completely okay. So what are the things we need to really look out for?
Right. The symptoms sometimes just stares at us in our eyes. Sometimes your family member or friends may actually realize drooping of the face, change in voice. These are mild, early symptoms, right? You can have weakness of your hand. Simple thing like dropping the spoon. Or
when you say dropping the spoon, is it the grip, or how is it your hand just suddenly drops?
No, it's the grip.
Okay.
Okay. This can be subtle symptoms.
Your left hand or right hand? Sorry for asking.
Anyone, depending which side the stroke happens. Your brain, 90% of us have our brains sort of cross-wired. So if you're a right-handed, you're left brain dominant. And if you're left-handed, you're right brain dominant. But 10% of the people actually have it on the same side.
Oh,
wow. Okay.
Okay.
So it's a losing of grip, you know, drooping of the face. Is there anything else?
One of the common symptoms, which I think nobody can say they've never experienced, is headache.
Yeah.
So what is your normal headache
Yeah.
and when do you suspect a stroke? Well, most patients with a stroke actually will describe the headache as the worst headache of their life.
Is it like a migraine headache?
No, a migraine is something that they are used to.
Okay.
They get it frequently, right? They usually, even those with migraine will actually tell you this is the
worse.
worst headache in my life.
Okay.
So if you have a sudden severe headache, some of them end up with vomiting, then you need to seek medical attention as soon as possible.
So when there's a vomiting or really severe headache, that's like a really dangerous sign that it's imminent.
Yes.
Oh, wow. You know, what can I do if I suspect someone that I know is having a stroke?
If he's conscious and alert, the first thing you need to do is bring him in to the nearest hospital. If he's unconscious, then you got to make sure that he's breathing. His breathing is not affected. Turn him onto his right side to make sure his tongue doesn't fall back and block his airway.
Okay.
And then call for an ambulance.
Oh, okay. All right. Wow. That's...
When you say don't block, I mean, in terms of his position, what do? We keep him there lying down? Do we keep them seated?
No, lying flat on the ground with the head, with the body turned to the right side.
Okay.
So that prevents the tongue from falling backwards.
Oh, okay, all right. You know, it's very eye-opening, whatever that we've heard so far, but we've got a whole lot more for y'all as we learn more about stroke. We'll be right back after this short commercial break. Stay tuned, guys. Hey guys, you're still tuned in here with us on VBuzz, and we are still speaking to Dr. Ramesh, consultant neurosurgeon from the Ara Damansara Specialist Center. Now, we were speaking about stroke. Now, before we went on the commercial break, doctor was just telling us about, you know, what we can look out for, you know, for anyone that might have a stroke or anything like that. But how do doctors in the ER diagnose a stroke?
When a patient comes into the emergency department, it may be a stroke, or it may be other diseases which may mimic a stroke. Even a heart attack may mimic a stroke. Or low blood sugar may also mimic a stroke. So they then sort this out, doing the ECG, checking your blood sugar. The next diagnostic test will be a CT scan of the brain. CT scan of the brain then tells us whether it's a bleeding stroke, hemorrhagic stroke, or whether it's an ischemic stroke. Then we may decide to proceed with an MRI. But the ER doctor has the main job of actually diagnosing whether this is a stroke or it is another illness.
Now, when you have sorted everything out and you know what is happening to that particular patient, what is the prescribed treatment for stroke?
There's no fixed treatment for stroke. It has to be catered individually. If we look at the hemorrhagic stroke or the bleeding stroke,
Yeah.
if it's a small blood clot, then we just observe the patient. If it's a large blood clot which is causing pressure on the brain, then that blood clot may require to be removed. Right? So we operate on blood clots which are actually compressing on the brain. I do get this question very often, doctor, there's a blood clot there, why are you not removing it? If it's causing no pressure, we don't take it out. All right. The other thing about the blood clot is we need to find out what caused the blood clot. It may be a blood vessel anomaly, like an aneurysm or an arteriovenous malformation. Then we need to sort out the source of the bleed and not just remove the blood clot. Right? If it's an ischemic stroke, then we need to unblock the blood vessel. Right? Just like if you cut your hand and you get a blood clot, initially it's soft and jelly-like.
Yep.
Then it becomes harder. So if you're in early, my colleague neurologist will be able to give an intravenous thrombolytic drug to dissolve the clot and re-establish the pathway. If it's a bit later and it's a bit more difficult, then we get our interventional radiologist who actually does an angiogram, goes up to the blood vessels and injects thrombolysis there.
Oh, wow. So direct to the source itself.
Yeah, if it's a bit more firm. The other thing that he can also do is actually to retract the blood clot. Oh, wow. Modern technology, now you have things like what they call snares, where you can actually pull out the blood clot. So this is actually a team approach. You may be treated by the neurologist, you may be treated by the interventional neuroradiologist, or you may be treated by the neurosurgeon. So it's a team. So treatment of stroke is individualized. You cannot say there's no general treatment.
Yeah.
Okay? It's not just about treatment. Then it's rehabilitation. So it's a whole team. The treatment is directed at damage limitation. Okay? So you get an injury to the brain cells, there's an area there. You want to protect the surrounding brain cells from injury. So that is why we need to go in early. Now, in our philosophy of treatment at Ara Damansara, we actually go on a team approach. So from the emergency room, when the patient is in, the whole team is actually alerted. There's a potential stroke. It might be the interventional radiologist, it might be the neurosurgeon, or it might be the neurologist who has to do the treatment. Then on the intensive care unit, once the patient is stable, we actually start our rehabilitation there.
Okay, so it begins immediately.
Immediately. And a lot of our patients are put out to sit on a chair. We do have special reclining chairs to support this patient. It's all part of re-stimulation and retraining the brain. Okay, even when it comes to rehabilitation, now there is a rehabilitation physician who is a doctor who specializes in bringing this patient back to life.
It's an entire package by itself.
As medicine gets more and more specialized, I guess, you know, that's the outcome of it. But I'm just wondering, Doctor, just now you likened stroke to like a war. You know, you can either be a casualty, you can survive, or you can come back, survive, and still have the after effects, which more often than not seem quite debilitating in a stroke. What can we do to prevent a stroke, actually?
Identifying the risk factors for the stroke, which is, again, your high blood pressure, diabetes, your cholesterol levels in your blood. These are risk factors. Other causes for stroke, like you even have stroke in children, which may be blood vessel abnormality. These are things that you cannot actually pick out. So you can only control your risk factors, healthy lifestyle. Okay, that's what they say. This can control, but you cannot prevent a stroke completely.
Is there any supplements or anything that you can eat to sort of prevent it?
No. I would explain it in this way. You're driving on the road, you don't want to meet an accident, you are careful.
Okay.
Right?
Yeah.
So you take your precaution, but somebody can still come and hit you.
True.
Okay. Wow.
So the key message is you've got to have a healthy lifestyle, reduce your risk factors. If it happens, seek attention immediately.
Okay.
And that's what you would say also affects younger and younger people, because that's the story now that makes the news. You've got friends, relatives, whoever, who are younger nowadays that are affected by stroke. Why is that, though?
Well, we are seeing younger patients with hypertension, diabetes. In the recent, I've actually had 2 of them with a stroke that I've actually had to refer to. These younger patients with hypertension and diabetes, I like to bring in the endocrinologist to look into them. Because sometimes you can have occult tumors causing high blood pressure. Right? So endocrine tumors that may cause blood pressure. So they come in. So he told me just the other day that he's actually seeing almost 1 to 2 cases of young hypertensive a week now.
Wow.
There's just one endocrinologist, so the numbers are increasing. Right? Besides that, the stroke in the young usually occur due to blood vessel malformation, like I mentioned earlier, aneurysms, arteriovenous malformation. So this may suddenly rupture. What causes them to rupture, we suspect, is always a sudden rise in blood pressure. So again, stress levels. Mind you, your blood pressure is not at a fixed level. Probably the best in the morning. By the end of the day, when you get angry with everybody down the road, your pressure probably goes up. Right? So I've had even children who have had a bleed in the brain. And but they've done well.
Okay.
I think when it's spotted early on and the right treatment is done to it. So, you know, just to quickly recap, you know, it's taking care of yourself, basically, you know, just being vigilant about your health, what you eat and stuff like that. That's the best way to sort of prevent it in a way. Thank you so much for speaking to us today, Doctor. It's been very, very eye-opening for all of us.
Yes, it is. And speaking about eye-opening, Imagine, you can close your eyes or not close your eyes, it's up to you. Now, when Disney acquired Lucasfilm, Luke Skywalker and Mickey Mouse became part of the same corporate universe. And while fans wait for The Force Awakens to hit theaters and for the Star Wars attractions to arrive at Disney theme parks, a new trailer imagines the House of Mouse travel to that galaxy far, far away. Thank you for doing that. Take a look at this.